Hey guys, it's Dr. Anderson at Life Essentials Chiropractic in Missouri City. And our patients are always telling us that what we do is just so different than what they've experienced before at a chiropractor. And there's a lot of things about our particular process that are way different, but that's why our results are so amazing with our members. So I just want to take a little bit and explain to you the process. So if you come into the clinic, you may have been to a chiropractor before and had some muscle work or some physical therapy or some stretching or some stimulators or just, come on in and lay down and get an adjustment. And all those things are great and have their place for the right person at the right time. But we believe in taking a customized approach and taking it a way higher level of correction. There's so much more available nowadays when it comes to state-of-the-art rehab, customized evaluations, pre and post testing to make sure we're not only getting symptomatic relief, but we're correcting the real root cause of the problem. We are fanatical about correcting the real root cause of the problem for a lasting change and taking it to the highest level possible because we believe you deserve that. What would you want for your body? Do you want just the most basic type of treatment or do you want the best care possible, right? Most people want the best care possible. So how it's gonna start is you'll see me or one of our doctors when you come in and we're just gonna first not just lay you down and start adjusting things, move things around. We're gonna get to know your situation. We're gonna find out what your health goals are and where you're starting and where you're suffering and how it's affecting your life and what are you really trying to get from this. And then we're gonna do an evaluation. We're gonna take imaging when it's necessary. We have imaging on site. We don't have to send you across town. So we do digital state-of-the-art x-rays here on site. We can measure your spine literally to the millimeter and figure out exactly where the root cause of the problem is. We can measure it. We can take you through a process called corrective chiropractic care, which can, in a nutshell, basically, if we have a person like a patient here, and we're taking a picture of their pelvis and their lower back, and we can clearly see that she's, over 1.25 inches misaligned on one side of her pelvis where it's become shifted and rotated. There's also an area where the spine's been shifted and bent to the side. It's weakening and irritating the nerves, causing pain and numbness and tingling and burning down her legs. But those are the same nerves that control digestive function and things like that. That person is actually a nurse, so she's been lifting patients. We take care, one of the biggest populations people take care as nurses, lifting people, bending over all day. And being a nurse, she's talked to the doctors at the hospital. She's tried the physical therapy, she's done the stretching, and it's helped her get some relief for a little while, but it always comes back. And it's remained there long enough where it's actually stressed the disc enough where it's actually started to swell and injure the disc tissue. Now, that's something that over time will continue to progress like a cavity. When you have a spinal problem and it's not taken care of the right way, it can remain. And if it remains like any health problem, little by little by little, it can continue to progress and grow. So when we talk about correcting the root cause of the problem, we want to make you feel better, but we don't want to just stimulate it or stretch it or rub it to make it feel better. We want to make sure we're actually getting better function, better physiology, and better healing in the area. So this is an example of corrective chiropractic care. Once we're able to, I measure the exact cause of the problem. We have a 15-degree angle misaligned the spine, affecting our work, it's affecting with their kids, misalignment of the pelvis. Over the course of just little by little, it's not a quick pop, it's not a quick treatment. It requires commitment and dedication, but it's not hard. Maybe 20 minutes for a session, couple days a week. She was able to go through an 8-week corrective process to just simply move and train and move and train and move and train little by little over time. And on our next evaluation, we were able to get literally 100% resolution of the root cause of the problem. We were able to create a laser beam aligned spine, laser beam aligned hips, open up the pressure that was on the disc, open up the nerve roots in her lower back that's irritating her legs. She haven't had the symptoms. She's now been under a wellness program for over 1.5 years after the fact, just because she wants to maintain functionality. She's never had a symptom return. She can play with her kids, go to the park, and do what we call a life without limits, without worrying, am I gonna hurt my back or age poorly or not be able to do things I wanna do every day at my job. So if you're suffering with any sort of problems in your neck, your back, your spine, sciatica, disc problems, migraines, numbness, tingling, I want you to know you really don't have to be. We get amazing results. We're over on Highway 6 in Missouri City. We've been seeing hundreds of people just like you every week for over 15 years. We just celebrated our 15-year anniversary. And today I want to let you know that for the first 20 people just like you that want to take us up on our offer and see if we can help, we have a special discounted rate where you can come in and just meet with the doctor, see if it's a right fit for you. It's not a quick fix, but it's a great fix. And it's a more permanent fix, and it's a lasting fix. And at the end of the day, we find that's really what people are really looking for. So if that's you, we'd love to talk to you soon. Have an awesome day.